Hi, my name is Beth. I'm a registered nurse and I'm nationally certified in maternal newborn care. I'm here today to talk to you about neonatal hypoglycemia, which is a really big word for low blood sugar in your newborn baby. Infants experiencing low blood sugar is very common. According to the American Academy of Pediatrics, 5 to 15% of newborns experience low blood sugar. In my hospital, we deliver about 160 babies a month. That would be about 8 to 24 babies every month in my hospital alone that are trying to stay out of the NICU. My goal in this video is to address misinformation that has been circulating on the internet. There are people who are creating content targeting parents, saying things like vaccines and vitamins and baby formula are poison, and that nurses and doctors are doing unnecessary tests on babies. And because of this, many parents are presenting to the hospital to have their babies, and they are refusing vital assessments and life-saving treatment. And I want to educate parents on the importance of monitoring the blood sugar. After viewing this, I hope that you are comfortable knowing that interventions that are being applied are all being done to, according to best practice in the safest way possible. I did take some time in the past couple of months to develop a blood sugar log, and I did implement it in this practice the past 5-6 weeks, and I've gotten really positive feedback. It's got simple language on it, and it helps me as the nurse and the patient, who is my daughter. Hi, and my granddaughter here. And it helps us work together so that she can stay focused and on track with keeping track of this baby's blood sugar. So the reasons that we need to take care of a baby's blood sugar, and I didn't know if you knew this, but while a baby is inside your tummy, her pancreas is reacting to your blood sugar level, which is much higher than a baby should have. Isn't that wild?
That's insane.
Yes, and if you had diabetes or gestational diabetes or steroid treatments or anything like that, your sugar would be even higher, and her pancreas would just be firing off all this insulin.
Oh no.
Yes, when she's born and we cut the cord, now all that blood sugar is gone, and her pancreas is still overreacting. That insulin level that she's creating that's going so high, it could cause her sugar levels to drop. And did you know that if her blood sugar levels get too low, she might start breathing fast, her body temperature could go down, she'll start shaking, she could have seizures, and she could even have brain injury and coma and death later on.
Oh no.
Yeah, we have to take care of that. So the first thing we need to do to prevent any of that is to plan, and preferably before the baby is born. What we want to do is get with the parents, and if any language translation assistance is needed, of course that will be provided. We want to make sure that we understand what the parents' understanding and their comprehension of this situation is, and at that time we would answer questions. The next thing is we will provide education, and we use current protocols, evidence-based practice developed by the American Academy of Pediatrics, and a subsection of that, which is neonatal and perinatal medicine. Finally, we'll develop a plan. What does that plan look like? Well, if your baby was identified as being at risk for low blood sugar, then we're going to check the blood sugar. That sounds kind of scary. Maybe we can check on my granddaughter here, and we can see what checking a blood sugar looks like.
Yes, sure.
Okay, so the first thing I do is identify my baby, and I check the mom's bracelet as well. And then I would go ahead and get my glucometer after I've cleaned my hands and put my gloves on. I'll scan my baby to help identify her and also set up my machine. And at the same time, I'll put a heel warmer on her, which will start preparing her little foot to warm up. That brings the blood to the surface, and it helps with comfort for the little baby. So after her foot is warm and my machine is ready, I would get my alcohol pad and my gauze. I'm going to go ahead and clean her little foot off. And then I have my little tiny lancet made for babies, where I would make a small little prick on the corner of her heel. After wiping away a few drops of blood, my machine will take a tiny little drop of blood and it will give me a reading. That will tell me what her blood sugar is, and then I'll apply a Band-Aid. And this can all be done with her laying on her mom in her arms or on her chest to keep her comfortable and to help mom feel better that she's not being taken away from her baby. So now that we've done that, I just need to educate mom and dad and the family. I need to check this baby's blood sugar every 3 hours for this first 24 hours. I need to check it before the baby eats, which means the baby has to eat every 3 hours. It's important that I look at a fasting blood sugar because that helps me know how the baby's pancreas is adjusting now that it's been born. If the baby's staying on track and the blood sugars are staying in the normal range, that's great. Sometimes the blood sugar gets out of range. Sometimes the blood sugar goes low, and that's when we have medically indicated interventions. These interventions would include a dextrose glucose gel. It's a 200 milligrams of dextrose in 40% of purified water. It is given and prescribed in a very specific amount that is per the baby's weight in kilograms. It's 0.5 milliliters per kilogram. And the way I administer that is just by taking my gauze pad and I very carefully clean the inside of my baby's cheek. I take on my gloved finger a small amount of that sugar gel and I just wipe it inside my baby's gums and their cheeks and I massage it in, and then the mom will immediately feed that baby. I will come back in 1 hour. At the same time, we can also prescribe formula or donor breast milk or expressed breast milk as long as we have 3 milliliters per kilogram of that baby's body weight to monitor going into the baby. And that helps us give prescribed amounts of glucose or formula to raise that baby's blood sugar to prevent serious injury. It's important to know that if the baby's blood sugar does become too low and the baby becomes symptomatic, that is now a medical emergency and they may be sent to the NICU. That is for IV hydration and IV sugar administration. Really just for peace of mind, want to express that assessments and interventions applied to the baby while in the hospital setting are always weighed against risks and benefits, and our goal is to keep your baby safe. Of course, we will progress with the least amount of intervention, and we want to listen to you. We're never telling you what you have to do, but always giving you advice, the safest, most up-to-date, evidence-based practice that we can. I hope this has provided comfort and knowledge, and that you know that we mean to only protect your baby. Thank you. Bye-bye.